All right, friends, this is the final video of BNF Chapter 1. Today we're covering stoma care. Short topic, but exam important. Let's finish this chapter strong. Let's begin. Okay, now let's understand stoma care properly. First of all, what exactly is a stoma? A stoma is an artificial opening made on the abdomen. Its purpose is simple: to divert the flow of feces or urine out of the body into an external pouch. This procedure can be temporary or permanent depending on the patient's condition. The most common types you'll hear about are colostomy and ileostomy. But remember, other stomas can also be created, such as gastrostomy, jejunostomy, duodenostomy, or cecostomy. Don't worry if these terms are new to you. Just take your time, pause the video, look them up, and try to understand the idea behind each word. Now here's an important clinical point. To manage a patient correctly, especially as a pharmacist, you must clearly understand which type of stoma the patient has and how extensive the surgery was, because that directly affects drug absorption and prescribing decisions. Now, let's move to the most exam important part: prescribing. Prescribing medicines for patients with a stoma needs special care. Why? Because the normal process of drug absorption is altered. This means there is a higher risk of poor or incomplete absorption, so we must choose medicines very carefully. Dosage forms: what to avoid and what to prefer. First, let's talk about dosage forms. Enteric-coated and modified-release medicines are generally unsuitable, especially in patients with an ileostomy. Why? Because the drug may pass through the gut too quickly and the active ingredient may never be released properly. So instead, we prefer quickly dissolving and easily absorbed forms. Liquids, capsules, uncoated tablets, soluble tablets. These are usually well absorbed, and here's a very practical point. If a patient is taking a tablet or capsule, the contents of the stoma bag should be checked. If you see tablet remnants, absorption is poor. Excipients matter: sorbitol. Some preparations contain sorbitol as an excipient. Remember this clearly. Sorbitol can act as a laxative. So in stoma patients, it may increase output and worsen dehydration. Now let's go through important drug groups, one by one. Opioid analgesics can cause constipation. This is especially a problem in colostomy patients. Aspirin and NSAIDs can cause gastric irritation and bleeding. Fecal output should be monitored for traces of blood. Antacids, very high yield antacids, behave differently depending on type and stoma. Calcium-containing antacids cause constipation. Magnesium-containing antacids cause diarrhea, especially dangerous in ileostomy. Can cause osmotic diarrhea. Aluminium hydroxide antacids cause constipation, may be a concern in colostomy patients. This is a classic MCQ area. Antidiarrheal drugs, loperamide and codeine phosphate, reduce intestinal motility, reduce water and sodium loss from an ileostomy. But remember, loperamide undergoes enterohepatic circulation, which may be disrupted in short bowel patients. Fluid, electrolytes, and potassium. Patients with a stoma are very prone to fluid and sodium loss. This can lead to hypokalemia. Usually potassium supplements are not routinely required, but hypokalemia is still dangerous. Why? Because it can increase sensitivity to digoxin, very important drug interaction point. Diuretics. Diuretics must be used very cautiously in patients with ileostomy, urostomy. They can cause severe dehydration, potassium depletion. If needed, potassium-sparing diuretics are preferred. Iron preparations. Iron behaves differently based on the stoma type. Ileostomy, diarrhea; colostomy, constipation. Leakage may cause sore skin, stools may appear black. If oral iron causes severe GI problems, parenteral iron is licensed and can be used. Laxatives. Laxatives are risky in stoma patients. In ileostomy can cause rapid and severe loss of water and electrolytes. Use with extreme caution. In colostomy, bulk-forming laxatives are preferred. They help form solid stools and improve regularity. Potassium supplements. Liquid potassium preparations are preferred. Modified release forms should be avoided. To prevent osmotic diarrhea, the daily dose should be split into divided doses. Finally, let's talk about basic stoma care. Patients and carers are usually educated in hospital by surgeons, stoma care nurses. They receive guidance on cleansing agents, protective creams, lotions, deodorants, sealants. And remember this important point: voluntary organizations also provide long-term support, education, and reassurance to patients living with a stoma. And that's it, friends. We've completed stoma care and officially finished BNF Chapter 1. If you found this video helpful, make sure to like, share, and subscribe so you don't miss the next chapter. Keep studying smart, stay consistent, and I'll see you in the next video. Let's keep learning together.